am Dr. Rajesh Trivedi. I am senior pediatrician practicing in Sabarmati since last 40 years. I will speak today on poor eaters and picky eaters children and its association with vitamin B complex deficiency. Vitamin B complex deficiency in children, it directly impairs the appetite regulation, creating a cyclical nutritional vulnerability. B complex acts as an essential coenzyme that converts food into cellular energy and maintains central nervous system and signals hunger centers in the brain. When a child lacks these micronutrients, metabolic process slows down, causing anorexia or poor appetite, fatigue, and potential developmental delays. The physiological connections of to a loss of appetite is thiamine and hunger signaling. Vitamin B1, that is thiamine, plays a direct role in regulating appetite through hypothalamus pathways. And a deficiency blunts brain's natural hunger triggering factors, leading to immediate food avoidance. Energy production also slows down. Vitamin B3, that is niacin, and B5, that is pantothenic acid, B6, that is pyridoxine, breaks down carbohydrates, protein, and fats. And without them, systemic cellular energy drops, slowing gastrointestinal motility and decreasing the child's drive to eat. B12 and taste distortion. Severe B12 and folate deficiency can lead to bursitis, sore throat, swollen and completely smooth tongue and mouth ulcers. And these structural changes alters or diminishes the taste perception and making eating uncomfortable and unappealing to the young child. So it's a vicious cycle. Low B12 intake or low absorption suppresses the brain hunger signals. It leads to loss of appetite. It leads to reduced micro food and nutrient intake, and that worsens micronutrient intake deficiency and growth stunting. This cycle is particularly harmful in pediatric age group because prolonged drop in food intake does not just keep vitamin B level low, but also it causes secondary deficiency of iron, vitamin D, calcium, leading to poor growth and poor weight gain and failure to thrive. When speaking on this topic, I will emphasize pediatric vitamin B deficiency rarely presents as an isolated picky eating. We should instruct parents provide a look for the concurrent signs also, like unusual irritability, low energy, apathy, structural or development delays such as delayed walking or delayed speaking. Then there are some physical markers like pale skin due to megaloblastic anemia, that is low B12 or B9, cracked corners of the mouth, that is angular ciliitis, smooth tongue or brittle hair. And some gastrointestinal symptoms are also there like chronic indigestion, mild nausea, bouts of diarrhea that further decreases child interest in meals. The common cause of this thing is nutrition poor diet. Diets heavily reliant on processed foods, carbohydrates, lack the whole grains and fortified foods. This is a hidden hunger. The unsupplemented vegetarian diet lacks in vitamin B12 strictly found in animal products. So vegetarian people do not take meat, fish and egg, and they have got vitamin B12 deficiency. Exclusively breastfed infants of vegetarian mothers who do not get supplement are also at the exceptionally high risk. Underlying gut issues like celiac disease, chronic diarrhea, small intestinal bacterial overgrowth disrupts the vitamin B12 absorption and leads to vitamin B deficiency. We must screen with a complete blood count, checking for the macrocytic anemia, specific serum B12 and folate profiles when a child presents with persistent poor appetite. We must introduce vitamin B rich foods gradually. Excellent pediatric choice include whole grains, fortified breakfast cereals, lean poultry, fish, egg, legumes, bananas and dairy products. If clinical deficiency persists, immediate dietary adjustment may not be enough because of the lack of appetite prevents inadequate intake. In these cases, pediatrician should we have to prescribe oral B complex syrups targeted with B12 therapies to quickly break the cycle and restore appetite and allow the child to eat normally again. Thank you.